Hi, I'm Dr. Rajdeep. I'm a dermatologist practicing at Charma Clinic in JP Nagar, second phase, Bangalore. Today I'm going to discuss with you about psoriasis or psoriasis. There are different pronunciations for that. Some of us prefer to say psoriasis, which is the American style, and Indian style we say psoriasis. So what is psoriasis? Psoriasis is a type of inflammatory condition. Inflammation is a process which our body's immunity produces to fight against bacteria, viruses, etc. So when something goes wrong with this immunity, the body starts producing several diseases called autoinflammatory diseases. Some of these autoinflammatory diseases are also called as autoimmune diseases, where specific antibodies are produced which damage certain parts of the body. So in psoriasis, there are no specific antibodies produced. So it's called as autoinflammatory condition. There's a lot of inflammatory mediators which are produced, which cause damage in several parts of the body. So we know that psoriasis is a skin disease, but how do you know if the rashes which you have is psoriasis or some other problem? So usually psoriasis affects common areas like scalp. It may look like dandruff in the scalp. They affect the hands, the outer part of the hands, usually around the elbows, sometimes around the knees, the back, the lower part of the back, including the buttocks. And in some cases, they affect only the palms and the feet. So this is a different type of psoriasis. And there are various clinical types in psoriasis. Very rarely, psoriasis affects the flexures. Flexures means the underarms, the inner thighs, or the area between the buttocks. So that's a very rare form of psoriasis. And many times that form of psoriasis is confused with fungal infections and treated wrongly for many months or many years until it is diagnosed to be psoriasis. So is psoriasis just a skin disease? No, it's not just a skin disease. That's where the problem arises. Psoriasis is a systemic inflammatory condition, which means that it can cause inflammation which causes damage to internal organs as well, not just the skin. One of the common presentations of psoriasis is arthritis, not as common as a skin condition. About 10 to 15% of psoriasis patients will develop arthritis over a period of time. Arthritis in psoriasis will involve small joints, usually the fingers, the heel, the toes, not like the large joints like knees, but it can also involve large joints, which is more rare presentation. So this arthritis is a problem because it causes permanent damage. It causes damage to the joints and it can cause deformities. The fingers can get twisted. Patients may not be able to do their day-to-day activities because of severe pain and swelling. And also the damage can cause problems in their day-to-day lives, because if your joint is damaged, you might not be able to pick up things. Simple things like that you might not be able to do. If you are using your hands, if you are an artist or you're a musician or a surgeon, so you're using your hands, or you're a chef, so definitely this disease will affect you. And all of us use our hands in some way or the other. Even software engineers use their hands for typing. How do you know when to consult a dermatologist? You might notice some rashes and it may be coming back again and again. It may be seasonal and it might start spreading to the rest of your body, and sometimes it may be associated with some joint pains. So if you have any rash which is not coming down in 1 week or 10 days or 2 weeks, you have shown to a general physician, they have given something, it keeps coming back again and again, better to take an opinion from a dermatologist, because psoriasis can affect the entire body. What are some of the dangerous things which psoriasis can cause? One of the most dangerous things is that psoriasis can increase cardiovascular diseases, that is diseases affecting your heart and blood vessels, 50% more than the general population. So your chance of getting cardiovascular diseases is much higher. You may develop BP, you may develop heart attack, you may develop other cardiac issues if you are having psoriasis for a long time. So treatment for psoriasis is important. It's important to understand it's not just some rashes which come on the skin. It can also have serious internal effects. Now that we have understood what is psoriasis, which areas it affects, and when to consult a dermatologist, let us discuss how we treat a patient or how we manage a patient with psoriasis. So, psoriasis is a long-term condition and there are very effective treatments for it. They range from simple ointments, they can go all the way up to some advanced medication like biologics. So today I'll discuss more about biologics because it's a recent advance in the treatment of psoriasis. Biologics are molecules which have effect on the immune system pathways, and they're usually made up of proteins, and they're usually monoclonal antibodies. So monoclonal antibodies means all those antibodies are very similar to each other. It's like a clone. They're all very similar, and they target one specific protein or one specific inflammatory mediator which causes that particular condition. So the idea behind biologics is that when you are targeting only one specific thing, you are not causing a problem to the immune system. But as we use them, we realize that they can have certain other problems. Sometimes blocking one pathway may increase the reactions in some other pathway. So biologics have been used for more than a decade, probably almost 2 decades now. And in India, it has been used for about a decade. Recently, we have some very good biologics which have almost no side effects, which are being used for psoriasis. The only issue with biologics being they're very expensive to produce. So they involve production of proteins which have to be stored at a particular temperature, otherwise they get degraded. And they are very effective because they are known to clear psoriasis lesions. Even 100% of the lesions can be cleared in some patients. Whereas with certain tablets and ointments which are using earlier, only about 75 to 80% clearance could be got. Now with biologics, we are looking at 100% clearance. And another advantage of biologics is they affect all parts of the disease. So they'll reduce the inflammation in the body, they reduce the effect on joints, and they reduce the skin disease as well. Some of the common biologics which we use in psoriasis are, the older ones are etanercept and adalimumab. The newer ones which we use are secukinumab, sekizumab, and there are many other new ones in the pipeline which are being launched by various companies. So there are many more biologics available in Europe and in US, and they are covered under insurance. Unfortunately, in India, psoriasis is not considered as a disease which affects the patients enough to be covered by insurance. So I hope that changes. I hope that awareness about psoriasis will change this perception, and I hope that insurance companies will include biologics and other treatments for psoriasis under medical insurance. If you have any doubts about psoriasis, please visit a dermatologist near you. Discuss your doubts with them, and it might take 2 or 3 visits to understand what treatment is working best for you. It's also important to follow up frequently with them initially. So initially, when you start treatment with a new doctor, you might need to follow up monthly. Over a period of time, once they understand what medication is suiting you, even once in 3 months or 6 months or even a yearly visit for maintenance would be sufficient. I hope this helped you all.